Hi, everyone. I am here today with Chris. Chris recently became a patient of mine, and I asked him to share his personal journey with testosterone replacement therapy, or as some people call it, TRT. The information in this podcast today is not meant to diagnose or treat. You should seek medical advice from a licensed provider prior to starting any sort of hormone replacement therapy. So, got that out of there. Welcome, Chris.
Hi, how are you?
Good. So,
Good.
again, thank you so much for being here with us today.
Of
And I
course.
have a list of questions that,
Sure.
a lot of people I think don't really understand testosterone. And that's why I think it's good to get a patient's point of view. So, I am going to start with question number one, and that is, can you share your personal journey with what led you to consider testosterone replacement therapy?
Well, sure. I am 50, almost 54 years old, and I recently had a child, and he's about ready to turn 1 years old, and he's like my fourth kid, my third son, and I thought, I really need to rededicate myself to fitness and just health overall. And so last August, I went to find a trainer, and I found a trainer. I found the toughest one I could find, and we just started lifting weights, like a really intensive program, some conditioning, and I got to where I know I could get easily, up to kind of a strength level, and it wasn't like I was looking for tremendous, like, bulk. I wanted to do strength training. I didn't want to do anything light, but I wasn't looking to really maximize, but I noticed that I had hit a plateau that I hadn't really realized before in my life. Like, it was like, man, I feel like I have the strength, but not the stamina type of thing. And my trainer recommended you. And so I went over and saw you, and I didn't know a lot about it. But then when we started to go over some of the other effects that a low testosterone level can have in your life, like inadequate sleep, sex drive, energy levels, just overall productivity, I could identify with so many of those guys. Like, I haven't slept well for a long time, and I haven't had that. I noticed that I'd lost a step. So we went ahead and took my levels. They were low. They were really, really low. And I had low T. And I was like, it kind of like when I learned how I had low T, I was like, it wasn't really off-putting. It was just more of a realization, like, God, I have low T. And so we started the treatment. That's how we got
Yeah.
into it.
Yep. So a big one is sleep. The next question was symptoms. So you just went over a bunch of different things. You said poor sleep. That's a big one.
Yep. Yep.
And with the sleep thing, like a lot of people, that's like your recovery. So I
Yeah.
think that that's an important one is sleep and energy levels. So your energy levels were low. How were those things impacting your daily life? How did that
Well,
how did
one one of the things really was, when you just mentioned recovery. It was like, and it just came out kind of more with the weight training, but I could recognize it from my daily life. Like recovering from a leg day at the gym, it would take a week. Or from, doing a big project in the yard. It was just like my legs were constantly sore. And that was one of the big impacts. It's like, wow, when I realized that's what's going on, I am not recovering. My muscles are not recovering. And the sleep, of course, is just a drag on everything during the day, just that lack of being able to sleep. And I would have had no idea that that was from low testosterone levels, or I would have looked into this a long time ago, because I've suffered from a lack of sleep for a decade.
wow, wow. So, I know how you got diagnosed, but can you share with how you were diagnosed? Like what happened?
Well, I came in and I talked to you, and we went over like I said, the effects of low testosterone, what the symptoms are, and I decided to go ahead and go ahead with you and get my labs drawn. And so when we did that and the results came back, they were eerily low. I mean, they were way lower than I thought they would be. And it was just a no-brainer just to start the treatment, which was a specific treatment. I'll let the doctor explain what that is, but it's not an injection. It's like, well, I'll let you explain it, but
Okay.
very non-invasive, very easy
Mhm.
to handle. And I read and I was told like the results could come within 3 weeks, or you could start feeling something maybe 6 weeks. I am telling you, I felt it within a few days. I felt different, and I had proof. I mean, I had proof of it. It was a miracle, and it continues to get better.
Yeah, it's so yeah, you talked about labs. So we drew your labs, we looked at your free and total testosterone. We also look at your estradiol level. It's important
Yep,
for men to have those levels checked. And we also look at a complete blood count. So those are the labs that we
yep,
did. And it is, I don't know what the word, I guess it's, I think a lot of patients, when they see their results, are kind of like, wow, like it's real. Like it's kind of like, all of these things that they've been going through, here's the answer right here on a piece of paper.
yes,
So I think, regardless, even if you're not feeling symptoms right now, like if you're having
sure,
issues with sleep, it's good to have a baseline. I think personally, I think if you're over 40, it doesn't hurt to check levels. And
yes,
the treatment, so I have a preference for doing testosterone cream for both my male and female patients. The cream itself is, I think, instead of injections, gives you much more of a balanced level. So it's a daily treatment. For men, it's twice a day, and for women, it's once a day. But I personally think that because it's not an injection, your
yeah,
levels stay very balanced. And I personally wouldn't want to do an injection myself, but a cream,
no,
yes, I can
yeah.
manage. Yeah.
Yeah, a cream I can, and I think the symptom onset too, when I think about it, it's a lot like when I first found out that I needed to wear eyeglasses. I was like, in my early 20s,
Mhm.
and I had just this gradual, I had 20/20 vision up until, and then it didn't just one day hit where I had poor vision. It just gradually came, and
Slowly
you can't
progression.
really, yeah, you can't see
Mhm.
it. And it was the same with the testosterone. I couldn't see it, I couldn't see it just overnight, like what's happening. But I remember having thoughts along the way, I'm just going to say the decade before we started treatment, where I remember thinking, is this it? I mean, is this what the rest of my life is going to feel like? Am I never going to get that feeling? What do I need to do to get
Mhm.
that feeling back?
Right.
You know.
What did you have any concerns or hesitations before you started treatment?
Yeah, no, when when I first had heard, there's a general, I think, idea out there that testosterone can be dangerous for your prostate. It can be dangerous for, or there are certain, like, advice out there like, oh no, don't mess with the natural,
Mhm.
that declining of your energy, of your power. It's natural and shouldn't be disturbed. And, so you get that in your mind, but
Mhm.
I'd done my research, and then for talk, before we had our appointment, and I saw that no, the mainstream is do it. It's not horrible. It doesn't have any side effects. There's certain
Mhm.
things you need to watch, but it's not it's not this outrageous idea that you would
Mhm.
replace your hormones.
Right.
and
Yep.
just but so many times I think you hear the mainstream, like the safe answer, that you get the safe answer from the big names out there at anything. you know Watch this, don't mess with the natural process. No,
Mhm.
that's not what most people think, is what I saw.
Yep. Yep, I would agree. It's more of like like you mentioned when you said, "Is this it?" Like,
Yeah,
that's aging, like, that is
yeah,
kind of what people experience, both men and women, at a certain point, and a lot of it is due to losing hormones,
yeah,
and specifically for men, like research has shown year over year, men's testosterone levels are dropping due to the sedentary lifestyle,
Yep.
the stress, all of
Yeah.
the different things, the foods we're eating today, like it
Yeah.
has had a huge impact on testosterone levels.
Yeah.
And there's also lots of research that shows how it's linked to depression and anxiety. So, like, it's something to look at because testosterone has so many benefits for both men and women.
Yes.
And like you're describing, quality of life is such an
Yeah.
important piece, like being able to do the things that you want to do, yard work, working out, those sorts
Right.
of things. I mean, it shouldn't be when you're in your 50s that's it's over.
Yeah.
That
It's
shouldn't
over.
be.
Yeah,
Yeah.
it's over. It's just
Yep.
done. And you're like, well, I have so much more to do. And it's not just a gym thing, although that's where it starts for I think a lot of people is in the gym for men. And that's where it started with me. But that's where you see that's where you can see an obvious effect of having low T, where it's like, man, it's just that strange feeling of like, I know I have the strength to, bench this amount this many times. I just did it last month. I know I still have that strength, but I don't have the power or something,
Mhm.
it's like I don't
Mhm.
have that
The
that
drive.
that little
Mhm.
the drive.
Mhm.
And that's one thing I've noticed now is getting to those sticking weights in the gym. And I just mentioned the gym, not because that's the ultimate advantage of testosterone, but it's like I said, it's a signal. Get to
Mhm.
that point where I would exhaust myself and it's just still there. I have
Mhm.
that last 50%, and it translates into a lot of things. I'm getting up earlier, I'm sleeping better, kind of feeling that has just made this an amazing journey so far for me.
Yep. So that was another question I had. How has it affected your energy levels, your mood, and overall quality of life? So
Oh,
you've seen in a very short period of time a huge change.
yeah, yeah. I'm one of those people that is, I try to be happy, and make other people feel good. I mean, I don't want to,
Mhm.
bring my problems whenever I can, and I try to mask them.
Mhm.
But then I've had I have all these episodes too where you feel down, and maybe you feel like you don't have a lot of confidence and this and that, and it can be kind of a up and down thing. Well, I've way evened out. I mean, I'm in a good mood. I'm just in a good mood. And
Yep.
I find that, just I mean, I've had a baseline, I think, level that's just been kind of drifting down. And some areas have still been, okay, but especially like, in the bedroom, it's been amazing. It's just been amazing to feel just additional arousal. I'll just be
Mhm.
blunt, like that
Yep.
additional, just in addition to what you already had, and it's almost like it's like taking a, I don't know, it's like taking a few years, going back a few years in your life is what I feel
Yep.
like back into the 30s maybe.
That's good. That's awesome.
Feels good.
So have you had any side effects, like in terms of negative side effects? Have you noticed anything at all?
No, nope, not at
Okay.
all. I'm not one bit. It's with the cream. I think you have to be careful because you don't want to transfer
Yep.
it. But I mean, if that's the biggest thing, it's like that's really manageable. It's extremely manageable.
So this is where we're going to kind of sum up the whole interview here.
Okay.
What advice would you give to somebody who is considering testosterone replacement, but they're unsure? What advice would you
Well,
give them?
I would tell them that there's a bunch of information, the internet.
Yep.
And if they look at that, they're going to find exactly what I found. They're going to find that the mainstream, the knowledgeable opinion is that there are no hidden risks to this.
Yep.
That there may be some things that you may want to monitor, but you want to monitor them anyway.
Right.
And
Yep.
that people have been doing this. This isn't new. It's like
Mm-mm.
it's been around, but
Yep.
the science, the applications, and stuff like that The creams, they're so easy to use. And then go talk to your doctor. Go find a doctor like I did that
Yep.
that is up to date on these things, and then make your decision. But don't go by, what you might hear from this person or from that person, positive or negative. There's enough
Right.
information out there that you can find it on your own.
Yep.
Um, and I do it fast because there's no reason to delay.
Yep. Yep. That's
I might,
kind of go ahead.
yes. I just might want to add this one thing just about me. I wasn't looking for this. It kind of just like, it was recommended to me. I wasn't out there, seeking it one way or another. So when I started to look at it, I looked at it from a really neutral corner because, I wasn't knowledgeable. And that was a good thing, I think, for me because I was able to get a really, I could look at it. I wasn't dead set that I was going to go and get this. I didn't even know what this was really until I
Yep.
started looking at it and talking to people and found doctors. So
Well, I can say that whoever recommended me to you, it was great because this is what I love to see. I love to see patients benefit from these different sorts of treatments that, I think there's not enough education out there, enough real education out there that, it's not every provider should understand the benefits of hormones and, whether or not they know how to treat, they can
yeah,
recommend. So that's a
yep,
big piece is that, you know, I'm not I don't like prescribing things for depression. I like finding out why you're feeling depressed. So it's one of those
sure,
root cause things.
yep,
So, why aren't you sleeping well? It's all of these things. It's things that we as patients might need to fix, but there's also options, more
yeah,
natural options out there.
yeah, yeah.
So, thank you so much, Chris,
Thank
for
you. Of
sharing your journey with us today.
course.
And I will, if you have any comments or if you have any questions, please leave them below. And hopefully, you've gotten some good information about testosterone replacement therapy. Thank you so much.
Thank you.